Hey Siri, how do you care for someone with CLL?
I found 9,640,000 results for how do you care for someone with CLL.
Hi, we heard that you had some questions about chronic lymphocytic leukemia. My colleagues and I on the line actually all specialize in CLL, and we'd love to help you navigate this journey and answer any of the questions that you have.
I know a bit about CLL from some of my online research, but how do I ensure the information I'm getting is reliable?
Many patients are looking for reputable sources of information, and when those questions come up, there are a number of good sites out there, and I think it's important to stick to those that really provide a robust, in-depth discussion of reliable information rather than getting drawn down any of the unusual bunny trails that the internet offers.
And if I'm caring for someone with CLL, how should I show up for them? Is there anything specific I should be doing to support them?
So, from a caregiver perspective in CLL, I think my first advice is always you can't take care of someone else unless you take care of yourself. So from a caregiver perspective, we want you staying healthy too. Now, specifically from a kind of treatment and surveillance standpoint, I think caregivers are extremely important in helping monitor the CLL. Sometimes, we tend to, as people, minimize things, right? Stress of work, life. Sometimes we forget to make that doctor's appointment, or we push it off because it's a little difficult to get there and we've got a million other priorities. A caregiver, you are responsible for helping keep them on track, right? It's helping remind them about those appointments. Maybe you take them to those appointments, right? Because coming to your oncologist's office is always kind of scary. Having someone there, even if you don't say anything, just the moral support of taking them to that appointment, I think goes a very long way.
Is this typical for a caregiver to be actively monitoring their loved one's symptoms?
You help us keep the patients honest, and that's important because we can't optimize our care and our adherence and the ultimate treatment plan for our patients without having a good idea of what's going on. So as caregivers, you're vital.
If there is someone who is not very proactive in identifying their symptoms and identifying that things have changed, then you'd rely on a family member who would convey that message. And so I think in the discussion about what symptoms to look out for, it should be not only with the patient but with also the primary caregiver for the patient, so that they are aware of what is going on and when to reach out.
Sounds like a lot. I feel selfish, but is it normal for a caregiver to feel drained and worn out?
Extremely important for caregivers to find their support system as well, right? Becomes a little bit of a burden to be the sole support system for the patient, so you also need to take time for yourself. There are always resources available to caregivers. I would highly recommend that anyone reach out to their oncology. Typically oncology clinics will have a social worker available that either works in the office or is affiliated with the hospital. They are always an excellent resource for things like whether it's travel resources, emotional resources. They're usually a wealth of information to kind of help you tap into things that are going to make you a healthier and happier and better caretaker for that loved one.
One final question. How can I tell if my loved one's symptoms are because of CLL or because of something else like older age?
Now, there's something very important because CLL is often a disease of the elderly, and many of the things which we discussed can just happen. When someone is getting older, people can have a little more fatigue than what they were when they were, a few years back, or they may have easy bruising just because of skin which is thinning out. They may notice some decrease in appetite just from aging. So it's sometimes a little bit difficult to tease out if certain symptoms are happening because of CLL or because of natural aging process, or very importantly, many other comorbidities which they may have.
Wow, good to know. I definitely feel more equipped to handle this, but it sounds like I'm going to need some support.
Caregivers are so important in a patient's treatment and in a patient with CLL. And I think the important thing that sometimes gets overlooked is typically when a patient gets diagnosed with CLL, it's not just the patient that's going through this, the patient and the caregiver. We hope this information will be useful in navigating your caregiver journey.